Every day, something dramatic happens in the Caribbean that affects our lives. We'll give you the details. We'll give you the facts on Caribbean Perspective with Eddie Frederick. Here's Eddie Frederick.
So glad you can join us. Moderna has made a quota of their vaccines available to Latin America and the Caribbean. This story takes the lead in today's edition of Caribbean Perspective for Tuesday, 16th November 2021. Details when we return.
Conveniently located in the Grand Anne Shopping Center, for over 40 years, Food Fair has provided quality service at affordable prices. Now, grocery shopping is made easier and more convenient from the Food Fair web store.
Hey, babe. Listen, I need you to go down to Food Fair to get some groceries.
All right, no problem. Right away.
Thanks, babe. What are you doing? You're supposed to be going Food Fair to get a grocery, man.
I am, but didn't you know you can order your groceries online from the Food Fair web store?
Are you serious?
Of course. All you have to do is just to log on to www.foodfair.gd with credit card in hand, and with an order of $100 or more, Food Fair Grand Anse will deliver up to 3 miles away. And you don't even have to worry about your information, you know. Their safety measures are excellent.
So hold on. You just order online and Food Fair will deliver to you?
Yep.
Oh, baby, better hurry up and order, man.
I already did. They should be here any minute now.
Enjoy easy online shopping anytime from your home or office from the Food Fair web store. Food Fair, where you can fill your baskets without emptying your pockets.
Welcome back. Moderna vaccines available, according to Antigua and Barbuda's Prime Minister Gaston Brown. Ragib Aparicio of ABS News reports.
We have had good news from Moderna in that they have finally decided to make a few million of their vaccines available to Latin America and the Caribbean. I believe they'll be making them available through the COVAX facility, so we're likely to get them at a reduced price, even though they're still expensive and more expensive than the AstraZeneca vaccines.
Prime Minister Honorable Gaston Brown speaking on his weekly radio program on Point FM Saturday. The acquisition of 10,000 doses of the Moderna vaccine in the first instance is one of the government's latest measures to boost vaccination numbers while curbing COVID-19 infections. The Prime Minister, who received the Moderna vaccine earlier this year, says vaccines have been instrumental in the country's recovery.
Our hospitalizations and deaths are reducing. So in addition to the protocols and the different measures that would have introduced, the vaccines would have played a significant role in reducing the level of COVID transmission.
Eligible minors between the ages of 17 and 12 are required to avail themselves of the Pfizer-BioNTech COVID-19 vaccine to remain in the physical classrooms, a mandate which took effect last week. Prime Minister Brown says once the opportunity arises, the country will procure vaccination options for minors as young as 5 years old.
I believe that very shortly, Moderna as well will have a 5 to 11 vaccine. And when we would have achieved those or sourced those vaccines, I want to encourage our people to, get their children vaccinated.
Efforts to acquire COVID-19 antiviral drugs also continue. Ragib Aparicio reporting for ABS News.
Despite a marked decline in the rate of active COVID-positive cases in recent weeks, Chief Medical Officer of St. Lucia, Dr. Sharon Belmont George, the COVID-19 Management Center fell short of meeting key objectives during the deadly fourth wave that commenced on July 25th. Although the fourth wave has subsided, the anticipated increases in airlift to St. Lucia this holiday season, together with eased COVID-19 restrictions, the CMO says, comes with significant risks. However, after enduring consecutive COVID-19 waves since last March, officials are confident the lessons learned bolstered the island's response plans.
Current COVID-19 data trends suggest the worst phase of the deadly fourth wave is well behind us. Active cases and positivity rates are at its lowest levels in months, and COVID-19 related respiratory hospital admissions are also down significantly. However, a recent assessment of St. Lucia's handling of the fourth wave that commenced on July 25th, according to Chief Medical Officer Dr. Sharon Belmont George, has attracted less than favorable reviews.
We have to be very cautious about taking measures from different countries wholesale and trying to implement in country. You have to take into account the population dynamics, the cultural practices, the literacy level of the population as well. There are certain things that can work well in one country that will just not work in your country. Unfortunately, some of our islands have been grouped based on the difficulty for implementation. So St. Lucia has been grouped together with Jamaica and Trinidad in terms of the difficulty of implementation of COVID-19 measures and the public health measures in country.
The declining COVID-19 data trends have since led to relaxed COVID-19 restrictions. Social activities have increased again. The threat of triggering another outbreak remains high, despite the reduced number of cases.
If we decide to open the country completely, this is what we'll get with the red upper limit. The orange, if we shut down completely, and we know the value of a complete shutdown, but we have reached stage 5 where we live with and create a balance. And if the level of activity that we are seeing on a weekend, our target of less than 100 will almost become unrealistic. And given the increased transmissibility of Delta, our normal threshold number may need to be higher than the 100. So we are looking at what is likely to be the green level of our baseline number of cases within country. But for us now, from a public health point of view, I'm not pleased with having such a high baseline.
Tourism is another threat that could resurrect the darkest periods of the fourth wave. Arrivals are expected to surge during the holiday and winter season.
We should not start the month with a high level of active cases, which is a high-risk month. The capacity for a massive wave in January will overwhelm our health system. So we need to keep the active cases below this, especially as we go into one of our highest risk months.
However, cases appear to be on the rise yet again in the island's tourism markets, including the United Kingdom and parts of the United States. Rihani Isidore, NBC Prime.
The hurricane season is now upon us, so we as Caribbean people need to remember to think safety and be prepared. Avoid venturing outside during a storm or hurricane, especially if there are strong winds. Rooftops and other debris are often blown about and can cause great damage.
You're listening to Caribbean Perspective with Eddie Frederick. The Bahamian government is moving on a sex offender registry, among other measures to track sex offenders.
All of the talk about a sex offenders register, I would question its efficacy. We live on an island 21/7. It'll take you exactly 45 minutes to get from one end of the island to the other end of the island, so I'm not sure what value there is on knowing who is on the 21/7. But if it may prevent one offense, we're going to follow through with it.
Minister of National Security Wayne Monroe, while acknowledging the calls from the public to implement the sex registry, suggested may not be as effective as many residents think. He revealed that his ministry is now considering a recommendation from the parole board.
That is a proposal that any dangerous criminal will be subject to being tracked and conditions after their release from prison. So if you are a sexual predator, when you're released from prison, we will monitor you electronically for up to 10 years after you get out of prison. To my mind, that is more useful because you will know we know where you are 24 hours a day.
While some in the public have also called for harsher sentences for such persons, Monroe says this recommendation is also better in line with government's move from correction to recidivism.
But sentencing people to jail for longer periods of time they will get out of prison.
Now, the full implementation of this register has been promised by successive governments. And while he has his thoughts, Minister Monroe says the contracts are already signed, so the Davis administration will be moving forward.
The software is here and available. That there is, I think, at least one person that it was being tracked to test the system. And I will find out on Thursday why it has not been fully deployed already. The impression I get is that it was ready to be deployed and was simply waiting on the say-so of the minister. The only change that I've seen suggested that instead of the person reporting just once a year, they report more frequently than once a year.
Janelle Longley, Eyewitness News.
U.S. Chargé d'Affaires Ursha Pitts, meantime, denies there has been an increase in visa denials in the Bahamas.
The U.S. Chargé d'Affaires Ursha Pitts dispelling claims that there has been a high volume of visa denials. This as she claimed that each case is unique and one is denied for good reason. In March of 2020, the U.S. Embassy in Nassau canceled routine immigrant and non-immigrant visa appointments to help control the spread of COVID-19. But 2 months later, embassy officials began to resume some services, starting with student visa appointments. Public Service and Foreign Affairs Minister Fred Mitchell expressed concern over visa denials in the House of Assembly last week for what he called no apparent reason. But Pitts says they address and assess each application with care and says there's been no increase in refusals.
More importantly, we have to remember that 80 to 90% of Bahamians that travel to the United States are not even getting visas. They're just, going and presenting their police certificate and traveling visa free. So it's a little strange to me that we would be getting complaints about visas, because this is not a country that even has to deal with visas. And in fact, it's the only country in the Caribbean that is allowed to travel without them. So we need to remember that this is not a generalized issue. It is an individual issue. And I also have to tell your listeners, Matthew, that each visa case has its own particularities, and we can't divulge individuals what their situation is. But if somebody is being denied a visa, that is their private business. Now, they can say whatever they want in public, but believe me, there's a reason why they've been denied the visa.
Despite the skyrocketing number of COVID cases being recorded daily in Trinidad and Tobago, Prime Minister Dr. Keith Rowley says shutting down is simply not an option. He's calling on the public to assume personal responsibility now more than ever, as the state will soon move to lift the state of emergency ahead of its expiration. TV6's Vanessa Cutting reports.
Over the last 4 days, TNT has amassed 1,959 new COVID cases. The Prime Minister is calling it a very dangerous place to be.
22 families today. They're in the dead. This is not a light matter. But at the same time, the response in a situation where 600,000 people will not cooperate, the response cannot be that, well, to turn the curve down, we shut the country down.
In this regard, Dr. Rowley says government is set to remove certain restrictions and allow the population to exercise more responsibility.
The state of emergency gave us breathing room to start and continue the vaccination program, but we can do without it now. So on Wednesday, the Parliament will meet and we will discontinue the state of emergency and we'll continue to manage the vaccinated population and the unvaccinated population under the public health ordinance.
Further relaxations are also set to take effect when the public health regulations are amended, including an increase to 50% capacity for in-house religious services.
Internal use to be 50% for christenings, weddings, non-religious indoor events at 50% capacity, and graveside we will allow 25 persons.
However, public gatherings remain at 10 persons. Government will also be extending safe zones to include public pools. Beaches, however, remain off limit for the time being.
If we do it and it contributes to what we are onto here, the second state could be far worse than the first. So we are holding it for a little while, but I'm hoping that before Christmas, we should be able to go back into the beach environment with some kind of restrictions. In fact, well before Christmas, I would say that maybe we could start with some morning opening up.
Renessa Cutting, TV6 News.
Conveniently located in the Grand Shopping Center, for over 40 years, Food Fair has provided quality service at affordable prices. Now, grocery shopping is made easier and more convenient from the Food Fair web store.
Hey, babe. Listen, I need you to go down to Food Fair to get some groceries.
All right, no problem. Right away.
Thanks, babe. What are you doing? You're supposed to be going Food Fair to get a grocery, man.
I am, but didn't you know you can order your groceries online from the Food Fair web store?
Are you serious?
Of course. All you have to do is just to log on to www.foodfair.gd with credit card in hand, and with an order of $100 or more, Food Fair granaries will deliver up to 3 miles away. And you don't even have to worry about your information, you know. Their safety measures are excellent.
So hold on. You just order online and Food Fair will deliver to you?
Yep.
Oh, baby, better hurry up and order, man.
I already did. They should be here any minute now.
Enjoy easy online shopping anytime from your home or office from the Food Fair web store. Food Fair, where you can fill your baskets without emptying your pockets.
I am Eddie Frederick. This has been Caribbean Perspective, a whole new approach to highlighting developments in the Caribbean. In the meantime, please continue to log on to CaribbeanPerspective.com for more daily news and more.